Here is our presentation on hearing impairment. Next slide. Hearing impairments can come from a variety of different sources, either being born with a hearing impairment or hearing impairment being caused from an accident, a disease, or from um, malfor. Sorry, that word is not coming out. But coming from a disease or medicines or something along those lines, and it can be from complete hearing loss to some hearing loss to different varieties, and every case is different. Next slide.
Your mic's muted, Mitzi.
What kind of bait do you use to catch salmon? What kind of bait do you use to catch salmon?
Next slide.
Okay, so there are 4 different types of hearing loss. The first one is conductive hearing loss, which can be caused by damage or obstruction in the external or middle ear. That disrupts the efficient passage or conduction of sound through those chambers. The second one is a sensory neural hearing loss, which is caused by damage to the inner ear or auditory nerve that transmits impulses to the brain. The third one is a mixed hearing loss, and that's just a combination of both the conductive and sensory neural hearing loss. And the last one is the central hearing disorders that are the result of a disorder or dysfunction in the central auditory system between the brainstem and the auditory cortex in the brain. And hearing loss can be described as either slight, mild, moderate, severe, profound, just depending on how well the person can hear the intensities and frequencies that are mostly associated with speech.
So as far as facts, history, and some implications, people who have the hearing loss disability, they are generally pretty independent. They can function just in regular life without like a companion or service help unless they use like interpreters at an event or use hearing aids. Now, it's actually been debated whether or not it can be classified as a disability. But cochlear implants, as you heard in the video, they were invented in 1982, and a lot of people, they have been able to hear for the first time as a result, which is pretty cool. Some legislation, there was a case that happened in 2009 of a man named Wilbur Almond, who was working as a security guard, and he had hearing aids, and they conducted a test where like it was a hearing test, and he failed to pass the test after they asked him to remove his hearing aids. Now the ACO security, they supported the decision, saying that he was medically unfit for the court, though the court held that the employers failed to provide reasonable accommodations for the test. So next slide. Now, a lot of studies have linked untreated hearing loss to irritability, negativism, and anger, fatigue, tension, stress, and depression, avoidance or withdrawal from social situations from not being able to understand, social rejection and loneliness from feeling isolated, reduced alertness and increased risk to personal safety, impaired memory and ability to learn new tasks, reduced job performance and earning power, and diminished psychological and overall health. So it definitely requires the support of those who are around people who suffer from hearing loss. Next slide.
Okay, so some of the learning characteristics that students tend to have is that they do have the same intellectual ability as other students, but when it comes to tests, they may have lower scores because they may not be able to understand fully the language. And they also have socially and emotionally, they are sometimes immature, and it's caused by two reasons, because much of the etiquette that children acquire comes from listening to others and imitating what they say or do, and then because of this, it can get confusing in interactions that involve many people and multiple conversations, and it can result in children avoiding them, which can lead to failure in developing social skills needed for those group interactions. They also have difficulty in following verbal directions as well as understanding some oral expressions. They often follow and rarely lead. And most of those who have hearing impairments can have some sort of language delay, but it's mostly severe in children who are born deaf, and it's less severe for those who have mild hearing loss that have already had some sort of treatment or intervention. They will usually also exhibit some sort of articulation difficulty, and they can become easily frustrated if their needs are not met. And then sometimes using hearing aids can lead to embarrassment and fear of rejection from the peers.
For eligibility criteria, we must determine if having the hearing impairment adversely affects a child's academic achievement and functioning performance, and some questions to ask for eligibility in special education services would include things like, is there a disability? Is there an adverse effect on educational performance from that disability? And are there specially designed instruction or related services and supports needed to help the student progress in general education and its curriculum? Next slide. And another part of eligibility criteria, does a student meet established federal guidelines for being classified as having a disability? And if so, what are the nature and extent of the student's disability? Next slide.
There are many accommodations that can be given to people who have hearing impairments. Lots of people are already aware of hearing aids, which are hearing devices that help people process hearing in their minds better. There are people also already know about sign language. But some of the things that people aren't very aware of is that children who have hearing impairments, they're able to have preferred seating, which means that the teacher in all of their classes can make sure that they're placed in the front of the classroom so that they're able to be near the teacher and hear them better and be able to watch their lips move, which can help them be more attentive. As well, there's such thing as an FM system, which is kind of like a walkie-talkie, but it's only a one-way walkie-talkie. So a teacher would be wearing a microphone on their shirt, and then they would speak into that during their normal class lectures. And the student with the hearing impairment wears headphones that is connected electronically to the messages that the teacher is saying, so that all of the words that the teacher says automatically go into their ears. And this just causes the child to not be as distracted by other classroom noises, since it's right there coming into their ears. As well, there's C-prints, which is just when a support person is able to come into a classroom and they're able to create all that is being said verbally into a captioned setting. So they type it, and then on another computer, a child with a hearing impairment is able to read what is being said in the lecture. And thank you so much for watching our presentation.